Friends, in this class, we will be discussing different approaches of enhancing bioavailability. In previous classes, we have seen what is bioavailability, what are the different factors affecting bioavailability, what is bioequivalence studies, what is the protocol of bioequivalence studies, and how to measure the bioavailability. So today we'll discuss about different approaches of enhancing bioavailability of poorly soluble drugs and the drugs which have the lesser bioavailability. So basically, students, drugs which have poor aqueous solubility and drugs with slow dissolution rate in biological fluids basically have lesser bioavailability, and the drugs with a low permeability also have the lesser bioavailability. So what are the factors for these low permeability and low solubility? So there are different factors, physicochemical factors and patient-related factors, which we have already seen in earlier classes. In physicochemical factors, particle size of the drug molecule, effective surface area of the drug molecule, dissolution rate, then polymorphism, pseudopolymorphism, amorphism, lipophilicity of the drug, pK and the partition coefficient of the drug, and stereochemical nature of the drug are the different factors. Then you have the patient related factors like GI content, food present in your in the patient's stomach, then the drug present in the GI environment, then fluids present in the GI environment, age of the patient, previous disease history of the patient, present disease condition of the patient, pH of the GI, gastric emptying time, gastric content, pre-systemic metabolism, enzymes produced in your GI like hepatic enzyme, bacterial enzymes, etc. will show effect on solubility and bioavailability of the drug. So basically, depending on intestinal solubility and permeability, drugs are classified into 5 different classes according to BCS classification. In class 1 type of drug, you have good solubility and good permeability. So there is no need of any approach to enhance the solubility for the drugs which falls under this category. In class 2 drugs, you have less solubility and good permeability. So here solubility is rate limiting, and if we want to improve the bioavailability of this kind of drugs, you need to work on enhancing the solubility. So next is class 3 kind of drugs. In class 3 kind of drugs, you have good solubility, but rate limiting step is the permeability. So if your drug falls under class 3 of BCS classification, in order to improve the bioavailability, we need to work on the permeability of the drug. And next, class 4 drugs which have a low permeability and low solubility. So if you want to improve the bioavailability of this kind of drugs, you need to work both on solubility and permeability parameters. And the next kind is the class 5 of BCS classification. So drugs which doesn't come under APO categories falls under this kind of drugs which have the poor solubility in GI lumen. So there are 3 different factors for this kind of behavior. Number 1 is instability in GI environment. Number 2 is first pass metabolism, and number 3 is complexation in GI lumen. So in order to handle this kind of issues, you need to go for the product approach, or you need to go for the enteric coating of the tablet in order to stabilize it in the GI environment, or using some other kind of approach. So before going to the different approaches, let us see what is dissolution rate and what is permeability. So when more than 90% of the drug which is given is absorbed into the GI environment and it is stable in the GI environment, then we can say that that this drug has a better permeability. And when a drug product with rapid dissolution is said when more than 85% of the labeled amount of drug dissolves within 30 minutes using USP1 or USP2 type of dissolution apparatus in 900 ml of a dissolution medium or the buffered solution at body temperature. This is dissolution rate. So if 80%, 85% and above of the drug is dissolved within 30 minutes in 900 ml of a buffer, then it is called as good dissolution rate. And if the 90% and the above of the drug absorbs and being stable in the GI environment, it will be considered as a good permeability. And these 2 parameters are important in order to understand or in order to improve the bioavailability. So if a drug has a good permeability and good solubility or dissolution rate, then it means it has better bioavailability. So what are the different approaches to enhance the bioavailability? There are basically three approaches to enhance the bioavailability of the drug. Number one is pharmaceutical approach. In this approach, we will modify the formulation, we will modify the manufacturing process, and we will try to modify the physicochemical properties of the drug. Number two is pharmacokinetic approach. In this approach, we will try to alter the kinetics of the drug by modifying the chemical nature of the drug or chemical structure or chemical properties of the drug. This procedure have two methods. One is pro-drug design or pro-drug approach, and other one is development of a new drug entity, NCE. Development of new drug entity have a lot of drawbacks, like it's very expensive, it's time consuming, a risk of altered or distortion of kinetics is seen, and risk of precipitation of the drug is seen, and even risk of adverse drug effects is seen. So pharmacokinetic approach is not so ideal. Biological approach, in biological approach we need to just change the route of administration in order to improve the bioavailability. So there are three approaches: pharmaceutical approach, pharmacokinetic approach, and biological approach. In pharmaceutical approach, you have four different methods. One is enhancement of drug solubility and dissolution rate. One is enhancement of drug solubility and dissolution rate. Another one is enhancement of drug permeability. Another one is enhancement of drug solubility and enhancement of GI retention. So enhancement of GI retention approach is suitable for class 2, class 3 and class 5 drugs. Enhancement of drug permeability is suitable or it is applicable for class 3 type of drugs, and enhancement of drug solubility and dissolution rate is suitable for class 2 type of drugs, because major rate limiting step in absorption and in bioavailability is basically solubility of the drug. So what are the different approaches of enhancing bioavailability? Pharmaceutical approaches of enhancing solubility. Number one is micro ionization. In this technique, we will try to reduce the particle size to micron levels, that is 1 to 10 micron levels, using spray drying technique, using fluid energy mill. The one more name of this method or approach is micro milling. So microionization is reduction of particle size to micron levels, 1 to 10 microns. Next is nano ionization. Now in this method, we will reduce the particle size to the nano range of 200 to 600 nanometers. So presently nano suspensions are available in the market. Pearl milling method, using of high shear and high pressure homogenization method, and using of colloidal mills are involved in preparation of nano ionization, and nano suspensions are the example of this method of enhancing the solubility, in turn enhancing the bioavailability. And the third approach is the new one. It's an supercritical fluid recrystallization. This method is also called as SCF method. Here, once the particle is solubilized in supercritical fluid, they may be recrystallized with reduced particle size. Supercritical fluids, example is carbon dioxide. They have temperature and pressures greater than their critical temperature and pressure. So they can exist both in liquid state and gaseous state at nearly critical temperatures. So these are much compressible liquids and fluids, and they will produce the particle microionized drug products. Next, you have spray freezing into liquids, SFL. We have seen supercritical fluids, SCF. Now you have spray freezing liquids. In this method, formulation is freeze dried to get free flowing microionized powder. Dissolution rate is remarkably enhanced using the SFL powders, and they contain amorphous nanostructured aggregates with high surface area and excellent wettability. So this is spray freezing of liquid. In this method, simply we will spray dry the formulation to get free flowing microionized powder. Next method is EPAS method. In this method, evaporative precipitation into aqueous liquids. Evaporation precipitation into aqueous liquid is seen. Here, rapid phase separation is seen in order to initiate nucleation and growth of nanoparticles and microparticles of lipophilic drugs. This is one more method of enhancing solubility. So we have seen micro ionization, nano ionization, using of supercooled fluids and using of spray freezing liquids and using of evaporative precipitation in aqueous solution method. Then we have use of surfactants, age old method. By using the surfactants we can get two things. One, surfactants basically promote the wettability, which will in turn helps in penetration of the dissolution fluid into the solid drug particle. And the second thing, what surfactants will do is they will reduce the interfacial tension, and they commonly are used at below critical micellary concentrations. So using of surfactants is the one more technique of enhancing solubility. Next, using of salt form is one more good approach in enhancing solubility. Salt forms basically have more solubility and dissolution characteristics when compared to their original drug. Basically, salt forms of the drugs will have 6 to 7 times more solubility than general drugs. We commonly see diclofenac sodium. Diclofenac is a drug, but diclofenac sodium is its salt form. It has a better solubility when compared with the diclofenac. Same in few of the examples like penicillin and atropine have very good solubility in their salt forms when compared to their parent drug. Then alteration of pH of the drug in microenvironment. Even this is one of the approach of enhancing solubility. You have two approaches in this: in situ salt formation and addition of a buffer to the formulation. These two are the methods of enhancing solubility by altering the pH. Next, selection of amorphous forms, then crystalline form, selection of anhydrates when compared to hydrates, selection of solvates when compared to unsolvates, and selection of metastable polymorphs also helps in enhancing solubility. So because amorphous forms have the better solubility, anhydrates have better solubility when compared to their counterpart hydrate forms, solvates have the better solubility when compared to non-solvates or unsolvates, and metastable polymorphic forms have the most stability when compared to the unstable forms. So this is one more approach of enhancing solubility. Next approach or method of enhancing solubility is solvent deposition. In solvent deposition, poorly water soluble drug is dissolved in an organic solvent and deposited on an inert hydrophilic solid matrix or inert hydrophilic polymeric matrix. For example, nifedipine is a drug with poor water solubility. This drug is dissolved in an organic solvent like alcohol. Then it is deposited on hydrophilic polymeric matrix like microcrystalline cellulose or starch. This will help in enhancing solubility of nifedipine. So this method is solvent deposition method. Next, you have three different approaches: solid solutions, eutectic mixtures, and solid dispersions. In these three methods, one common thing is there: the guest is poor water soluble drug and the host is highly water soluble compound. So you will take poorly water soluble drug and you will try to incorporate it in highly water soluble compound in order to enhance the solubility. So you have three approaches: solid solutions, eutectic mixtures, and solid dispersions. All these three techniques have seen that they are increasing the bioavailability dramatically. In solid solutions, basically these are binary systems comprising of soluble molecular solid soluble molecules dispersed in a solid solvent. So here solvent is a solid, solute is a solid. So the solvent or a drug is basically dispersed in an solid solvent in a molecular state. So how it's prepared? This is prepared basically by fusion method. You take solute and you take solvent, both are solids. So basically in solutions, one will be solute will be solid and the and solvent will be liquid. Example, if I am making a NaCl solution, sodium chloride is a solid and water is the liquid. But here in this case, solute and solvent both are solid, so it's called a solid solution. Here what you will do, you will take those both solute and solvent and you will heat them together and melt them together. When they melt together, they will be converted to their molecular state. Then you will subject it for rapid solidification. What's happening here? Because of rapid solidification, reduction of particle size to the molecular level is seen, and the solid solution shows greater aqueous solubility when compared to normal solutions. So this is also called as molecular dispersion, and this is also called as mixed crystals. As two components crystallizes together in an homogeneous one-phase system, they are called as molecular dispersions and mixed crystals. What's happening in solid dispersion? Solute and solvent, both are solids. You will take them both, mix them, melt them together, heat them together, and when they get melted, you will rapidly solidify it back. So this procedure is called as solid dispersions. Next, in eutectic mixtures, you can see when eutectic mixture is exposed to the water, then water soluble carrier dissolves simply, leaving the drug in an microcrystalline state, so which rapidly dissolves in the water. So this is eutectic mixture. Then you have solid dispersions. Solid dispersions and molecular dispersions, solid solutions, are similar. Even you have a fusion method being followed here. The only difference is the end product in solid solutions is crystalline form, and the end product in solid dispersion is an amorphous precipitate is seen. So in solid dispersions, basically you will take a poorly water soluble drug. Then you will add it to the carrier molecule, which is highly water soluble hydrophilic molecule, like it may be urea or it may be other kind of polymer. Then you will melt them together. Then you will go for solidification, and then you will add a solvent, common solvent, in which these both solute and solvent are soluble. So in solid dispersion, you will take a drug and you will take a polymer. You will mix them both in a common solvent, organic solvent, and you will try to evaporate. Solvent evaporation technique is the method, and after evaporation of the solvent, you will get amorphous solute molecules or amorphous final product, which is being entrapped or precipitated into the crystalline carrier. So these are the solid dispersion. So these three techniques enhance the bioavailability in very good method. And at last you have molecular encapsulation using cyclodextrins. So this technique is also called as molecular inclusion complexes. Cyclodextrins are basically beta and gamma cyclodextrins are bucket shaped oligosaccharides produced from the starch. Their nature is they are hydrophilic exteriorly, and they have a hydrophobic nature, hydrophobic cavity. So they have the ability to trap or to entrap the lipophilic drug, or you can say as hydrophobic drug inside them. So they simply entrap this hydrophobic drug, or you can say lipophilic drug, into the cavity, a bucket shaped cavity, and they have hydrophilic exterior and hydrophobic interior. So this method is basically very interesting and useful for enhancing the solubility. So these are different methods to enhance the solubility, which will in turn enhance the bioavailability. Micro ionization technique we have seen, where we are reducing the particle size to micron levels. Nano ionization we have seen, where we are reducing the particle size to nano levels. Then we have seen use of supercritical fluids. Then we have seen the use of spray freezing liquids. Then we have seen the method of e-pass, that is evaporative precipitation into aqueous liquids. Then we have seen the use of surfactants to enhance the solubility. Then selection of salt forms and conversion of the pure drug into the salt forms in order to enhance the solubility. Then we have seen the alteration of pH to enhance the solubility. Then we have seen the use of amorphous forms, anhydrous forms, solvates, and metastable polymorphic forms in order to improve the bioavailability. Then we have seen the method of solvent deposition, where poorly water soluble drug is dissolved in an organic solvent, then it is being deposited into the hydrophilic polymeric matrix like microcrystalline cellulose or starch. Then we have have seen solid solutions, eutectic mixtures, and solid dispersions. In solid solution, both solute and solvent are solids, and fusion method is followed. And in eutectic mixture and in solid dispersion also follows the fusion method, and solubility is enhanced dramatically by using these three methods. Then we have seen encapsulation of a drug molecule using cyclodextrin. So these are the different approaches, pharmaceutical approaches, to enhance the bioavailability. In coming classes, we will see another approaches of enhancing permeability, biological approaches, pharmacokinetic approaches, and techniques of enhancing the permeability.